are educated on how much commission we earn off of a bill. Okay, this is the compensation plan, and just for example, right? Just for an example, your cell phone bill is how much?
$76, I think.
$76. Okay. Now, this is the U.S. compensation plan with ACN, and we're gonna go to cell phone wireless. And we're gonna go to AT&T. Let's see, where's AT&T? Or we'll do Flash Mobile. Let's just do Flash Mobile. But we're gonna go off of $75, okay? All right, so you see where it says one line equals 2 points, but you get paid 90%. 90% of the bill is commissionable. Okay? 90% of that bill is commissionable. Now, 90%. This is just to warm you up to understand how much do we earn off of a single bill. So 90% commissionable from Flash Mobile. Bills. Okay? Now, your bill is $76. Your wireless bill is $76 a month. Okay?
Mm-hmm.
Now, everybody's got to eat. That's why that 10% is out there. Okay? And that goes to ACN and all the logistics that makes the Flash Mobile company operate. Okay? Mm-hmm. So that 90% broken down to anywhere between 3 to 20%, because you get paid 3 to 20% residual. So that's how much you take from that 90%, depending on how much points you have. Tracking so far? Now, let's say you have 3%. 3%, right? The bare minimum, 3%, 3 services, whatever. Because we get paid at a minimum 3% residual income. So, $76 times 0.03, because that's converted to percent. $76 times $76 times 0.90, right? Because that's the commissional revenue we get from that, right? So $76 times 0.90 equals 68. So now we have $68 to disperse. How are we going to disperse it? Depends on how much percentage of residual income you're at. Now let's say you're at 3%. So let's go 68, that's at 68.40 actually. $68.40 times 0.3%. So that's $2 pretty much a month you earn from that bill of $76 broken down. Okay? Who's excited about that?
Nobody.
Nobody. Now, the average bill of healthcare, based off of my data that I've been pulling the last couple of days, the average bill is $400 a month. $400 a month. Now, watch this. We're going to draw a line here. This is wireless, obviously. And this is impact health sharing. Okay, so the average bill from healthcare expenses that I pulled data from real people is $400 a month. We get paid 40% of this bill is commissionable. Okay? Now, since we know it's 40%, 3% to 20%, depending on where you're at, determines that split of what you get. So 40% of 400 is $160. $160. Now, of this $160, 3% goes to the bare minimum ACN IBO rep, because let's face it, once you become customer qualified, you earn 3% at the bare minimum. So 160 times 0.03 equals $4.80. You see how this is 90%, but this is all you get. But the billing volume is a whole lot larger for healthcare expenses at 40%, which is less than 90, but this is what you get at 3% residual income personal. Now, let's say you're at the max 20%. All right, we'll do this first. The max 20%. You maxed out on your personal residuals for Flash Mobile. Boom. So now we go 68.40 times 0.20. Now you get $13.68. But if you maxed out in Impact Health Sharing, maxed out on your 20%, meaning you got 200 customer points, you go 160 times 0.20, $32. And that's just off of one customer. That's just off of one customer. Obviously, if this number increases, so does this number. If they're paying more than $600 and we save them $100 and we offer $500, boom, this number still increases because it's more than $400. If that makes sense. Everybody's going crazy because healthcare expenses is at an all-time high, and we have an opportunity to save people money on their monthly health care expenses. Okay, this is not insurance, but it's the same concept, or it's like the same concept. You're able to go in, get seen, and get it taken care of accordingly as normal. So the whole world is paying your medical bill. This is like a beautiful concept. I'm surprised there's no one hardly knows about this concept, but I'm on a mission to help any and everyone I encounter to cut back on their healthcare costs and give them a free quote. This is why everybody in ACN is going crazy, because this is going to be the biggest payout in the history of network marketing and direct sales. Any questions?